Hello everyone and welcome to our panel discussion today, where we are joined by a group of fabulous speakers, and the panel will be hosted by the fabulous Helen Tomlinson. My name is Mel. I am the membership manager at Wellbeing of Women, and I oversee our employer membership program, which is our one-stop shop for supporting women's health in the workplace. So thank you so much for joining us today for this panel. The chat function is open, so at any point please do ask any of your questions and we will try and get to them at the end of the session. And handing over to Helen to start the session.
Thank you very much, Mel, and a very warm welcome to everybody today to our panel discussion, where we'll be discussing how to create a positive menopause culture in the workplace, which, if anybody who knows me will know, I'm very, very passionate about. As Mel quite rightly said, my name is Helen Tomlinson. I'm Head of Inclusion at Adecco. I'm an ambassador for Wellbeing of Women and the former Government Menopause Employment Champion. And I'm absolutely delighted to be joined here today by, in no particular order, Mel Redfern, who is the Senior People Operations Advisor and Menopause Network Co-Lead at AtkinsRealis, Lou Hymers, who's the Regional Growth Manager and Award-winning Menopause Champion at PwC, and Dr. Nadira Awal, who is an NHS GP, an accredited advanced British menopause specialist and founder of Pause & Co Healthcare. So I'm delighted to have you with me today. I think it's going to be a really interesting discussion, so I'm just going to dive right into it. So the first question to all of the panel, I'd like you to quickly introduce yourself and just answer the first question about why do we need to talk about menopause in the workplace? So I'm going to come to Lou, first of all.
Hi, and this is fantastic, and thank you so much for having me, first of all, with an amazing panel. So, as Helen said, I'm a manager in PwC, currently postmenopausal, although I kind of thought it finishes at that point when you're post, and it really doesn't. So I think that's why, actually, from a selfish perspective, it's hugely important to me, from my perspective, I'm still working very hard, very long hours to get that support, but also to open that door to wider topics and, in a nutshell, to make it less of a scary journey, because when I was at my worst, it was scary. So
okay, that's a really good context there. And you do think, oh, that's it, don't you? And then actually, yeah, it's not. So, yeah. And I'm going to come on now to Mel. Mel, what's your perspective on why we should be talking about in the workplace?
Oh, hi, I'm Mel Redfern, and yeah, really delighted to be here today as well. So from my point of view, I personally really passionate about raising awareness in the workplace because I work in such a male-dominated environment. But it's key because people think it just impacts, those born female at birth, but it's not. It impacts 100% of the population, because everyone has got a loved one, a colleague, or someone that they know that will be impacted by the symptoms. And when I've been asked the question at work, well, why do we need to train male advocates, or why do they need to be aware? Well, the answer is the majority of our workforce, line managers, are male. So they might need a male advocate to, if they've got a partner suffering at home and then they've come into the workplace, they might need to offload. So it's about us being fully inclusive and understanding that it impacts absolutely everyone, as well as the debilitating symptoms that many women can suffer with.
I agree. And I always say it happens to 51% of the population, and broadly we gave birth to the 49%. So, and also with 1 in 10 women leaving the workplace due to the symptoms of menopause, it's business critical. It's not just a nice
absolutely. Yeah.
Nadira, what are your thoughts?
Yeah, so thank you very much for inviting me today. My name is Nadira Awal. As Helen says, I'm a GP, so I see people at the front line who've been affected by the menopause. We are living longer, so this is why we need to talk about it. We're living longer. We're spending about a third of our life in the post-menopause. It means that we're working longer, we're having to work longer, we're having to juggle lots of things as well. And also it's about health promotion. So we're trying to minimise cardiovascular disease, so strokes, heart attacks, mini strokes, so TIAs as well. We're trying to minimize osteoporosis as well. So, but also we know that estrogen also affects our sugar level. So it might affect us, we become insulin resistant because we gain that weight around our tummy area. And so we can't break down the sugars as well so as easily. So there's a risk of diabetes. So it's all about health promotion for me. And that is why I'm really passionate about the menopause as well. So because we do see actually if we're replacing back estrogen, if people can have it, actually there is lots and lots of health benefits.
Perfect. Thank you. And I think the other thing that to consider is that actually, in terms of progress and a step forward, if you look at the employee rights bill that is just going through Parliament at the moment, one of the points in that is that any organisation over 250 people has to have a menopause action plan that they will submit with their gender pay gap reporting in 2027. It'll be a nice to have in 2026, and people, organisations are being encouraged to submit that as best practice, but by 2027 it will be a legal requirement to have a menopause action plan. So there is no time like the present to A, do the right thing, but B, make it a business critical initiative. So yeah, lots of reasons why we need to talk about menopause in the workplace. I'm going to come on to you now, Nadira, to talk so you can briefly explain what happens to our body during the menopause and what are some of the most common symptoms. And I know you are very, very good at this.
So I'll try my best, Helen. So basically in the we don't really often talk about the pre-menopause. We talk about the perimenopause, but we don't talk about the pre-menopause. The pre-menopause is merely the phase that's the run up to the perimenopause. So the perimenopause is where your hormones fluctuate really wildly. And this is where the ovaries are starting to get smaller. They're starting to stop producing the eggs. And so hormone levels fluctuate. So the brain can't really communicate with the ovaries. So you get this fluctuating of feeling really good and then feeling really bad and then feeling really good. And what's happening is the ovaries are becoming smaller and smaller, and they will eventually become smaller, and the brain will then shut off, and you'll have that natural decline of your estrogen and your progesterone and your testosterone levels. Now, it's basically the menopause itself, as men suggest. Men is short for menses, so period, pause, stop. So it's a stop of your periods. Now, in that, once you've had your final menstrual period, you are in the postmenopause phase. And I often say to my patients, the postmenopause finishes the day that you die. So Lou was saying, oh, I thought I was going to come out the other side. It's not. It's the only time you come out the other side is when you're 6 foot under. So, but in the post-menopause phase, what happens is the brain has shut down from the ovaries. It's not talking to the ovaries anymore. It doesn't need to produce the estrogen. It doesn't need to produce the progesterone as much. And therefore the levels become more of a steady state. So you're not having these fluctuating levels. So you might not be getting the classic symptoms of hot flushes and night sweats on a daily basis, but you might get them sort of every so often. You might have the joint pains, you might feel really good one state and then another you might not. So, but the levels become to that of the pre-menopause. So pre-puberty, puberty is when your hormone levels become, so really even before your ovaries start fully forming. Now, as the levels decrease, what happens? You get these physical symptoms, you get the mental changes, and this is where it can really affect someone's work. So they might get hot flushes, they might get the night sweats, but you might also become really cold intolerant as well. So people say in winter that they feel really, really cold and they're really feeling the cold, and no matter how much they wrap up. So people can get cold sweats as well. Then you get the sleep disturbances. So for example, if you're not sleeping well at night, you might have an impact on your work the next day as well. So you might be not being able to concentrate as much, and therefore you might be more irritable, you might be lower in your mood, you might have mood swings or emotional instability as well. So we kind of classically say, do women have this brain fog as well, where 1 minute they can remember things and suddenly you can't? So You might be prepared for this meeting, for example, and then suddenly you can't remember what you're talking about as well. And that is just merely just a quick decline of your hormone levels, which can happen within seconds. It could be you feel great in the morning, and then suddenly in the day, the hormone levels will drop, and therefore you have that brain fog. And then sort of symptoms that people don't talk about. So things like palpitations or breathing difficulties, or they might find that their gut has changed. They might have urgency to go to the toilet to open their bowels, or go to urinate as well. Or they may have vaginal dryness and they find it really uncomfortable, or they might have itching in the vulval area as well, or they may have reduced sex drive. We don't openly talk about it, and I think it's really important as well. So there's lots of symptoms. I could go on and on. There's sort of 50, 60 symptoms, but I use the analogy, actually, the menopause is like a drying condition. So everything dries up from top to toe. So dry hair, dry eyes, dry mouth, dry swallow, dry breathing, kind of dry gut, so constipation as well. So pins and needles in the hands and feet. So yeah, I could go on, but it is about affecting how you are progressing through your career as well. But fatigue is probably the most common, I would say, the workplace challenge. Definitely.
And that's really interesting that you talked about that drying condition, because I thought I'd heard pretty much everything around the topic of menopause, but actually I've never heard that before. And that is a really good way of describing it, that it's everything that's just drying up. So, and that relates actually to some of the, I guess, physical and the more cognitive symptoms as well. So, around the brain fog and things like that. So, and it has just been Menopause Mandate's recent survey that they did of 20,000 women. Brain fog was the most prolific symptom, wasn't it, that impacted in the workplace. And I guess that kind of depends on the type of role that you're in as well, because I think one of the really difficult symptoms are the hot flushes, because they can be so visible, but then also the heavy and erratic periods that happen to 44% of women, that nobody wants to have to talk about their line manager about their periods and how they're impacting on their work. But it's so important, because that just doesn't affect people who are in perimenopause. It can affect a lot of other women throughout their career for very different reasons. So that talking about it is so important. And I'm going to come to Mel now to ask her about what sort of initiatives have you put in place at AtkinsRealis to support women at work through this stage and more broadly in their career.
Oh, thank you. Oh, and thank you for that insight. Yeah, really interesting. So I co-started the network to support women mainly for my personal purpose as a mental health first aider, so from a psychological point of view. Initially it was looked at, do we need to change anything? So we introduced what was then a Yammer group. So for those that aren't familiar with Yammer, it's like a social network for in the workplace. So we introduced a closed Yammer group for women only, just to see if there was a wanting, whether there was a need that people wanted to talk about it in the workplace, and if support was required. And we were inundated. So we then had a number of men that were asking if they could join the group. So we put it out to vote to the women that were in the group, and 99% came back and said no. If it was opened up to men, that we wouldn't have the same open conversations, we wouldn't share the same, because there were some really personal experiences being shared, as you can imagine, some of the symptoms that have just been highlighted on this call already. So women were really sharing because they felt that they've got that safe space. So we opened up a second Yammer group, which was fully inclusive for everyone. And we've continued with that. So we've got one closed group, and then we've got one open group for everyone. And then hence then developed into, right, we need a support network. That then grew. So we've got the Menopause Network is a recognised ED&I network. And within that network, we've got 30 trained menopause advocates across the UK and Ireland. And I'm really pleased to say that the conversation is going global, because it's recognising that lots of different cultures are impacted differently, and sometimes work is their only safe space that they can come and have a conversation, because they can't talk about menopause at home, they can't talk about it with their families. So it's just about giving women that safe space initially, and then having that training in place with a specialist, and the signposting, the reputable signposting. So all the menopause advocates have had training, so they're consistent with the signposting. And we say we're here to describe, not prescribe. So that's instilled. All of the HR team have been through the training as well. So if any line managers or anyone raises a HR case or approaches HR, again, we can refer to occupational health, our EAP provider, Bupa. So there's a whole umbrella of holistic signposting that we can refer to. But as a network, we deliver regular lunch and learns on different topics on a regular basis to educate everyone. We've got an e-learning module that is just 15 minutes long, but it's really informative, because education is key, and it's that knowledge is power, because we're not taught about this life event at school. And we're aware that, a lot of GPs have only had half a day's training on it. So it's about giving women in the workplace that support and equipped to have those conversations and try to understand what's going on, because the amount of women that come to us as a network and say, thank God I've got someone to speak to, because I didn't know what was happening. I still don't know what's happening. I don't know if I am going through perimenopause. I'm not sure. I'm having these symptoms, but the doctor says I'm too young. So it's that safe space. It's that safe environment. So and on the back of that, it's we've started to change the culture, because we're embedding those changes. With me being in HR, I've been able to influence some policy changes. So therefore, I've been able to influence a reasonable adjustment policy, which includes menopause support, menstruation support. We've introduced an adjustment passport. And the reason why it's called an adjustment passport and not a reasonable adjustment passport is because it's fully inclusive for everyone. So someone doesn't have to have a disability and need reasonable adjustments under the Equality Act. It's an adjustment passport because someone might have those severe night sweats and need that flexible working. They might need temperature control, so they might need to sit at a specific desk or by a window, or they might need a fan. Or they might have caring responsibilities. So an adjustment passport is there not just for a permanent arrangement, it can be a temporary arrangement as well. So
very personal, isn't it, to an individual?
Very personal, and that's why it's called a passport, because the individual owns it, and it's up to them who they want to share it with.
And it also saves them from having to have the same conversation over and over again, departmentally and things like that in a large organisation, doesn't it? So, no wonder you are award-winning for the work that you've done, because there is so much there for people to think about and learn from. And what I particularly like is the fact that you talk about the fact that sometimes your group is the only place people have got to go to be able to talk about this. And so when you think generationally, there was a whole generation before us that didn't have anywhere to go to talk about it at all. So that's such a huge step forward, and in such a male-dominated environment, you should be really, really proud of that work that you've done. And I'm just going to bring Lou in to talk about in a very different kind of environment, but still the corporate environment. I'm really keen to hear what you've done as well.
Yeah, and absolutely, and I can absolutely resonate with Melanie there. And funnily enough, as Nadira was saying, I've been writing my notes, because if I don't write things down, they do get forgotten. And I have got to remember to change the aircon temperature in here, because it's lovely. It's freezing. Fabulous. But I think, yeah, absolutely. We've done a lot of stuff very similar at PwC, and I totally get that piece around the culture. I might actually just sort of talk a bit about that later on. But some of the other things that we've done in addition to what you've done as well is, and I'm super proud of this, is we changed our absence policy. And for me, this wasn't just about going through HR and our wellbeing teams to update our absence policy. So if someone has to take time off for a cold or whatever, you fill out your form, your reason for being sick. All very simple, very bog standard. But there was nothing on menopause. And I remember at my worst, I was probably averaging 3 hours sleep a night, if I was lucky, whilst sort of working between 15 and 19-hour days organising events. And I'd get to a point where I was so tired. I don't think if someone said, "What's your name?" I would have been able to answer them. The fatigue was just something else. But I'd have to lie and say, "I need to take time off. I've got a stomach bug." And I thought, no, I'm not having this. I'm not lying. This needs to change. But also it's that message that we need to empower our people. If your work is going to be impacted, and quite rightly, as Nadira says, a lot of these symptoms, if you're unlucky enough to have some of them, can be quite debilitating. And if you have to take that time off, we shouldn't have to lie about it. So when we got that through, and it didn't happen overnight, but it did take a few months, I was just super proud, because I thought it gives that message. And the other thing we're doing as well, again, to Melanie's points, is having loads of conversations with different people, different groups. We're doing a series of educational videos, but being really clear that actually we're getting key messages across, but also being really empowering, because I know at my worst, I wanted to kill myself. That's how bad it got. And I want to make sure that actually if we're educating people from everyone from the males in the office to the younger generation, everybody, I do want to make sure there's a sort of a positive message at the end as well.
Absolutely. And we'll come on to those positive, empowering bits a bit later on. But talk to me a little bit about how you got, and obviously to get a sick leave policy over the line, I assume you had to engage at a very senior level as well. How did you get senior leadership involved? Because I know from the work that I do, it can be challenging with employers. A lot of great work happens at those grassroots levels with networks, ERGs, YAMA groups, etc. But how do you get that top-down support?
Absolutely. And if I'm going to be honest, in a nutshell, I think there's nothing a hormonal woman cannot do. I absolutely think we're indestructible. And I guess for me, I was struggling. I was very stroppy. So my mood swings were the worst.
Yeah.
And I was looking for support, not only for myself, but for everyone in the firm. I didn't want people to feel how I was feeling. So when I started to look at what was out there, and I've worked here nearly 37 years, so I knew a lot of the process, but I'd never gone through anything like this. So I'd never kind of really considered well-being. I'm a happy, positive person, just cracked on and did my work. So there wasn't really a lot out there. So I thought, right, I'm going to make change. I can do this. And this is going back a long time ago now, but there was barriers I came across. And I just thought, no, this is not acceptable. I need to get those barriers down. And then in the end, I was in the London office one day, our big boss at the time, he only had 26,000 people to look after. It was a breeze. I just literally went storming in his room. And I was like, this is not acceptable. We need to make change. And he was fantastic. He was absolutely fantastic. And that is where it kind of snowballed. And we ended up doing a short video with ITN, which kind of went viral. And that had such a knock-on impact from actually one of my LinkedIn posts with that video, ridiculous, like 50,000 views in the space of a couple of days. But what that did mean is that I had a lot more senior people on board, a lot more staff on board. It literally opened doors everywhere, to even then other businesses contacting me saying, I want to do what you're doing. How are you doing it? So it was that just one stroppy day I was having to go in that room and tell him, no, change needs to happen. It was incredible. Incredible.
And that just shows the impact of one person, doesn't it?
Yeah,
And I think
because
that
I'm
is
really
something that,
junior. So yeah, absolutely. And again, like Melanie, we've gone global. But just, I think that's really key thing for me, that actually anyone can make change. It doesn't matter whether you're, what role you're in, everyone can make change.
Great, thank you. Now I've got one eye on the chat, and actually it's a question for you, Lou, so I'm going to come to it now, but could you share some examples of what specifically you included in the absence policy to support women with menopause symptoms?
I think actually it was like a business case, if you like, and a lot of conversations. That's the role that I played in it. But again, for me, that was really powerful to have a live example to say to someone in HR, I'm having to lie here about why I'm having to take time off sick. And for me, I don't feel comfortable doing that. I shouldn't have to lie. So I think definitely having some live examples with your HR person. We're incredibly lucky to have a really fabulous HR team and wellbeing team. So they kind of did the next steps, if you like. But I think for me, the first part is getting your examples, why you want to make change, and then have that conversation with your wellbeing and your HR teams.
Great. Thank you. Mel, what was the impact of opening up the conversation about menopause and policy change? What was the ripple effect for you, Mel, across your business?
There's definitely been an increase in staff retention, and also that whole attraction piece as well, because we've worked very closely with the talent and attraction team, and again, as Lou said, done in-house videos and promoted those externally and on LinkedIn, etc. And it was about getting that senior buy-in as well. So and it's knowing that we're not just talking the talk, we're actually walking the walk. So it's about leaving that legacy, isn't it? So if anything happened to myself and my co-lead on the network, if we were to move companies or whatever, then those changes are still in place and they will not go away because it's embedded. And I can add to that question around the sickness absence, because again, I've been in HR, I was able to influence some of our policies. And on the sickness absence, when someone fills out a self-certification form, we get a line manager to sit down and do a return to work. And as part of that return to work, depending on why an individual's been absent, so for example, if they flagged that they'd been off with menopause symptoms, then on the return to work, it would then flag for the line manager to ask, does the individual need an adjustment passport? Does the individual need to be referred to occupational health? Is the individual aware of EAP or any of the ERGs? So it prompts the line manager to ask those questions as well. So someone isn't just saying, I've been off with these symptoms. It's then, okay, you've been off with these symptoms. How can we help? How can we support you? What have you done to help yourself? Are you aware of what's available to you? So I think by having those policies and procedures in place, it's empowering line managers to be able to have those confident conversations rather than just shy away from it and say, oh, right, okay, is that why you were off? And that's it. So I think as well, as an ERG, we've got a senior sponsor, and he is our managing director for one of our businesses, and he is really active in his allyship and promoting the network, and he's very authentic in the fact that he's he's had prostate cancer treatment. He's on medication for the rest of his life, and he has quite debilitating symptoms equivalent to, you know, hot flushes, brain fog, and he's quite openly talking about them, and so he enhances it.
And you made that happen, because it's unlikely that he would have felt that level of comfort in doing that if the work you'd done hadn't changed the culture of the organisation first. So yeah, it's a knock-on effect, isn't it? And it opens the conversation about so many different topics. What I really like there that you said that it's embedded, and if anything was to happen to you or your co-lead, it's still fundamentally part of the business. It can't be one person's job, or it can't be one person's, you know, we use the word passion project sometimes, and I think that, you know, the fact that it's embedded in your business and in yours, Lou, as well, is really impactful. So yeah, really, really good work there. I'm really conscious there are a lot of questions in the chat, but I'm just going to come to our last question collectively before I go over to the chat, because there's some really good ones. And I know, Lou, you obviously, both your organisations are huge. And it's important that we involve everybody in the conversation, and it isn't just specific groups. So what have you done, or how have you made it work so that you've involved people, everybody, in that conversation from different backgrounds, you know, with different lived experience, etc., and got, you know, men involved right across the board? So Lou, I'm going to come to you first.
Yeah, so I think for me, I was really passionate about getting to start off with the male audience involved. Again, from a personal perspective, right, and I'm talking 10, 15 years ago now, my boss at the time was a man. So I wanted him to understand what I was like, you know, forgetting work, not being able to do 10 things at once like I used to be able to. And then it kind of evolved, actually. It wasn't that I had a plan, and obviously being in marketing, I am quite organised. I've got a list for everything. But it did evolve over time. And so what started was team meetings, actually, when we used to present to various teams on wellbeing topics. Then it would open up conversations, and myself and my colleagues who would do them, we would tailor the presentations to who the audience was. So predominantly we would have some team meetings that were more, you know, males in the room, or the younger generation. And that's how it kind of went a bit viral. And I think we probably presented to at least, over 5,000 people, I think, in team meetings. And it just has a knock-on impact. And that's literally how we've done it, just word of mouth. And again, getting the videos out. So it's a real internal push. But what that has covered, and actually what it's made happen, is a whole different conversations take place. So for example, we're talking about male suicide. Somebody who was on one of our menopause team meetings basically was like, I see what you've done here, and I see how you've made change, and actually I feel really passionate about male suicide because of, you know, for whatever reason. And so we're then having that conversation. And then again, transgender, we're having conversations around that. And it's having the smaller groups. And again, like Melanie, we have a group that I think we have nearly 1,000 members, that basically people will reach out because they know there's always going to be someone who's there to have a chat. And I probably have more conversations now, especially around people in same-sex relationships. And especially if they're both hormonal at the same time, that has a massive impact. You know, people with sort of children that are going through puberty, or their hormone levels, you know, that. But I probably have more conversations with males now, which is it makes me quite sad, some of the conversations I have. But I'm so pleased that people just feel empowered to be able to come and chat to us and try and get some support. So I think it's literally just viral.
Thank you. It's just viral. Perfect. Thank you. Mel, anything different that you've done?
Not really. I suppose in our team meetings, if there's a meeting for anyone more than 5 people, we do what we call a values moment, which is literally probably 3 slides, a few minutes at the beginning of each meeting to raise awareness on different wellbeing initiatives and topics. And we've got a library of values moments on our menopause SharePoint site that anyone can tap into and share. And obviously we've built those up over the last 7 years. But one thing that I am really proud of that I think has really impacted, especially the male conversation, is that we had 4 seniors last year do the Menovest challenge.
Oh, yeah.
And that was recorded. And so I've got to say 3 out of the 4 of them really engaged in it. So it's not just about them having to wear the Menovest to to recreate a hot flush as such, but the night before they have to set their alarm, so they have that broken sleep, they have to change the bed, they have to skip breakfast, they have to wake up late. So they're on the back foot as they leave the house. They're already late leaving, and then they can't, as I think I said, they can't have breakfast. And so then they get to the office and they have the brief, they put the Menovest on underneath their clothes so no one can see them, and they're videoed, and they do an introduction speech, and then at the end of it they take the shirt off and they put it back on over the shirt, and so people can see it. So that starts the questions being asked. But then at the end of it, the whole video, all 4 of them collectively said that they never understood how much of an impact it would have to them cognitively, because by having this sudden heat spell, they lose concentration, forget what they're saying, and they never had such a day at work where they've really had to think about what they're doing. And
that's all you can think about is the heat. And the anticipation of it. I think that's brilliant. And did you do that through Over the Bloody Moon?
Yes. Yeah.
So I know they were in King's Cross Station. I think it was either earlier this week or last week with Wellbeing of Women. People could go up and try it on and see the impact it had on them. But I think to do that in a corporate environment, doing it underneath your shirt as well, so you're only showing people what you were going through afterwards. I think that's really, really powerful. Well done. Really good. Thank you for that. There's quite a lot of, I did say to Mel before we started, there's always a lot of medical related questions in the chat. So I'm going to bring Nadira in on this particular one, which has come through from Adecco, I hope I'm pronouncing that correctly. It says, I had a hysterectomy and therefore I suffered badly for years because the issues weren't linked to menopause at the start. I ended up losing my job. Are there specific treatment for Black people? How can one keep the level of estrogen to a good level? Sleep, anxiety, weight gain are my worst symptoms. And I'm bringing that in specifically because we are talking about everybody's experience, because people, and I'm sure Nadira will talk about this, your experience of menopause is different based on race, ethnicity, culture, socioeconomic background, all sorts of different factors. So I'm just going to hand over to Nadira now.
Thank you, Helen. So Helen knows it's my biggest passion, talking about women in global majority who are going through the menopause. And we always talk about the menopause affecting women at the age of 51. You have your final menstrual period at 51, and that's it. Those studies were done in Caucasian women. They weren't done in Black women. They weren't done in Asian women at all. There's actually very, very little research when it comes to women of global majority. So we're talking about the ethnic minority groups. Now, there isn't one size fits all. So every person is completely individualized. Every person's menopause journey is different. So yes, we have sort of common symptoms. We may have, I might have had a hot flush. I might have had a night sweat, for example. Yes, there are common symptoms, but women of global majority actually have earlier menopause symptoms compared to Caucasian women. So they could be having menopausal symptoms as early as their 30s. Now, add in the mix of someone who's had a hysterectomy. So I don't know, Adecco, if you've had hysterectomy where your ovaries were removed, or if you've just had your uterus removed. But if you have your ovaries left in, what they're trying to do, and for any person who was born female at birth, if they have a hysterectomy, you can have just your uterus removed and you have your ovaries left in, which basically means you will go through your menopause at the natural age that is suited for you, basically. So they try and keep you as natural as possible. If you've had your ovaries removed, the day of your surgery is the day that you will go into the menopause. And suddenly it's like jumping off a cliff. You will suddenly have the symptoms as well. And I always say to my patients who come in before their surgery and they speak to me, I say to them, make sure you get your prescription for HRT before your discharge. Make sure you have started your prescription before you've even discharged. Discuss it with your gynecologist so we can get you treated. Why wait for symptoms to occur? There's no optimal level for estrogen. We know that there's certain levels that we like to achieve for good bone health, but we are looking at people's symptom control. So if your symptoms aren't well controlled on the dose that you're taking, please go back to your GP. It needs altering. So we obviously use licensed products, but there are specialists that may go off license prescribing, and we do that very safely by doing blood tests. But blood tests vary according to the time of day as well. So, or if you're applying your gel, or if you're having the patch on as well. So just be mindful. It is just a snapshot, because your hormones go up and down, much like with the HRT as well. They're not just a steady state. So your hormone levels will drop up and down. So it is based on symptom control really as well. So Adecco, please go back to your GP. But yes, my biggest passion is around women of global majority.
Thank you for that, Nadira. And I'm just honestly, when you think about progress and how far we've come, and I was thinking about my experience of having a hysterectomy, and I had a full hysterectomy. And as I left the hospital, the surgeon, and this is only in 2015, it's not in like 1975 or anything like that, in 2015, and the surgeon said to me, oh, by the way, you might go into menopause. Well, there was no might about it, because I'd had my ovaries removed. So, you know, we now know that I absolutely would have done. And I said to him, oh, how will I know? And he just said, oh, you'll know. And that was it. That was the only conversation that we had. It's ridiculous, isn't it, to think, but really good that we are having conversations like this now and being educated by somebody with your experience. So thank you for that. I'm going to go to another question now, because we do have quite a lot. So bear with me 2 seconds. In fact, I'm going to start at the top, because that would absolutely make sense. So this is a question from Nadira. Why do GPs get so little training for something that is experienced by so many to such a detrimental level? The symptom I struggle with most is anxiety. I was advised, because my main struggles are emotional, HRT wouldn't work and an antidepressant would be better. I ended up paying to go to a private clinic. Not everybody can afford to do that. There's a lot to unpack there. So Nadira, I'll hand over to you.
Yeah, so a lot to unpack. I think this is a global problem when it comes to medical professionals. So we often talk about GPs not having the knowledge, and actually it is part of our curriculum, but you can appreciate as a GP, we need to know about you from cradle to grave. So yes, the menopause affects 51% of the population, but we also need to, in that 10-minute consultation, we need to be able to make sure that we're ruling out other health conditions. So things like making sure you don't have a poorly controlled diabetes or poorly controlled high blood pressure, for example, making sure that we're not missing your cancer, making sure we don't miss your COPD or emphysema or anything like that. So, so it is part of the curriculum, but you can appreciate we have to do such a vast array of conditions in our 3 years of training that we can't spend a significant proportion of time on the menopause. I work with the Royal College of Psychiatrists, and they are actually going to put menopause on their curriculum, because it's currently not on their curriculum. And they're realizing that hormones play a huge factor when it comes to worsening psychosis, for example, worsening depression, people who are drug resistant, who've got drug resistant depression, for example, that we know that estrogen does play a huge role in our mental health. And I'm not dismissing that. But I also feel that antidepressants do have a role in our HRT journey, our menopause journey, I should say, beg pardon, because we have different neurotransmitters, we have different chemicals that are produced by the brain. And actually serotonin is a really important chemical. So it makes us feel good in ourselves, And the way that antidepressants work is it just helps block the reabsorption of that serotonin, makes us feel happier for longer. So even if somebody is on HRT and they feel like their mental state is not well controlled, antidepressants definitely have its role. It just works in a different way. So it's a different chemical. I kind of use the analogy that a menopause is like a big jigsaw piece. There's lots of different aspects. So with World Menopause Day coming up, it's about lifestyle. So I reiterate, actually, you need to be looking after your lifestyle as well. Are you exercising? Are you eating healthy? Are you on HRT? Are you on any other medications? Are you on medications that cause side effects that making your symptoms worse? So I had somebody who's on amitriptyline, a very common drug, made her feel really sleepy, made her menopausal symptoms worse. And so she was feeling really fatigued. We took her off the amitriptyline. Guess what? She felt better as well. So it's about looking at everything. So it's a work in progress. We are getting more doctors educated on the menopause, but it's a long way to go, I'm afraid.
Thank you.
Yeah, GPs get bad press, unfortunately.
They do an incredible job and very, very overworked and underpaid, I would say, Nadira. Another question, just a quick sort of yes or no one, really, on a medical perspective. I have terrible prickly heat, which is so embarrassing when working in an office. I have to go to the toilets to scratch. Is this a menopause symptom?
Yes. Would you like me to explain a little bit more? So so we have lots of histamines that come up in our body. So we find that allergy symptoms potentially can get worse as well. So for example, hay fever may get worse, or you might have rashes that come up. So prickly heat, very common. Take some antihistamines, take them daily. They're very, very safe to take as well. Absolutely fine.
Perfect, thank you. More of an organisational question now, so I'm going to take this across to Lou and Mel in a second. But for an organisation who doesn't know where to start, what would be a good first step? Lou, what would your recommendation be for a first step?
Well, firstly, thank you for that, Nadira. One of my worst times was the itching, and I never knew until now the reason why behind that. I'd just be sitting there itching for hours. I would, first protocol, I would find out who looks after your well-being. I think the majority of companies, small, large, because that's the challenge, I think, also with the size of your company, where you're going to get your support. So I think find out who your well-being person, your HR person, and see what's in place already, because I would probably imagine most companies would have something in place. I personally would then go to whoever is top of the chain and have a chat with them. And actually, just sort of very quickly on that, we had one company that telephoned me that was very male dominated, very male led, but actually the majority of their staff were menopausal women. And they asked exactly the same question. And I said, oh, is your CEO on board? And they was like, no, but I don't think he will be. And I don't think he needs to know. And I was like, right, stop right there. You absolutely need him on board. He needs to be supporting the staff, and actually don't, give him the benefit of the doubt. He needs to know. Happy to say they're doing fabulous now, but that's what I would do. Those couple of steps: HR, well-being, go and see the top person.
And I think just to add to that, if you don't have those, because we 95% of companies are SME, so and only a small percentage of people actually work for large corporate organisations. If you don't have that, be that person that starts the
exactly, set one up.
Yeah.
Absolutely.
And I know it can be tough, but actually I would say, and I'm sure Lou and Mel would agree, that the change that creates makes it worth being that person to stand up.
Yeah.
Mel, what are your thoughts?
Yeah, 100% agree with Lou, but I think from my own personal experience and works with some SMEs as well, is if they're some SMEs don't have a HR department or wellbeing and HR is together. So I think it's showing that there needs to be a change and there needs to be support. So even if you start off a small working group and have what your own menopause cafe or coffee stops, and introduce that safe space where people can come and share, and then you'll understand then what the need is for support, and then that will help you either put together a business case or then go to whoever you need to go to get approval for, to start that the support, the further support that's required at work. So I think, just start off small and see what support's needed, and open up those conversations, and attend webinars like this to educate yourself. Look at the BSI standards, the NICE guidelines, the CIPD, and just start to educate yourself so you can start to share those learnings a little wider. And that goes back to that knowledge is power.
And organisations create that for people to take away and use. So it's not like you're taking something that doesn't belong to you. It's there for a purpose. And things like the British Standards Institute guidance is free and free to download. It's a great way to start. They've created a little book as well that supports that. There's lots and lots of information on the Wellbeing of Women website that you can use, and that's what it's there for. And I am delighted. I was just reading the chat then, and Pauline Nicol is on the chat, so it's lovely to have you on the session, Pauline. And she's just said, in my organisation, Tesco Bank, the ripple effect included other people setting up networks that were relevant to them too. And I think that ripple effect is really important, that we build it out and it becomes inclusive, intergenerational. There is something there for everybody across the business, and using something broader like the topic of women's health more broadly allows you to do that, because there are so many other groups that wouldn't necessarily feel that a menopause cafe is appropriate for them at this time, but they might have some other challenge that they want to form a group to really support them with that. So it's that empowerment to go out and do that, which is, and I know you've done some incredible work in Tesco Bank, Pauline, that you should be very, very proud of. Just moving through the chats. How were you able to engage more men in the conversations? Our experience is that many men shy away from such discussions, often feeling quite uncomfortable talking about things. And we've touched a little bit on the male allyship and advocacy. Is there anything specific that either of you or Nadira would recommend?
So I'll take this one, if that's okay initially. So I ran an event, a men's only event for Gatwick Airport last year, and it was so well received. We had 50 men attend. So I was the only woman in the room. I felt very, very nervous actually. And it was interesting because at the beginning of the session, I actually asked them, does anyone in the room know a menopausal woman? 2 people put their hand up, and 2 people put their hand up because their wives were going through the menopause. I then asked the same question after my education session and said, does anyone know a menopausal woman? And every single person put their hand up. Because, as I think Lou or Mel mentioned, it doesn't just affect the person in front of you, it affects our wider network. It affects our friends, it affects our family, it affects our children, it affects everybody. So, and even the person on the street, if that person's having a down day and they're potentially menopausal, if you just give them a smile, it makes them feel better in themselves. The response I got from the men were they didn't know about the menopause. People are talking about it, but they didn't know the science behind it. They didn't know why things are happening. They didn't know if people are making up the symptoms. How could they prove that this person's going through the menopause? We talk about it. And I just went, you can't prove it. You have to just acknowledge that your colleague is having menopausal symptoms. So it's actually educating the men from a basic science point of view, actually, I think is really important, and letting them talk. So I had anonymous posting and they were talking about different things that they were scared of. And they were like, how do we support our wives or partners and things? And actually, it's just being there for them, let them vent. I know my husband really struggled with my menopausal symptoms, and he's a psychiatrist and he was really lost. So he's an educated chap, and I had really bad mental conditions, much like Lou. didn't want to really be here and really struggled with my menopause. So he was like, oh, maybe it's depression, maybe it's like psychosis or something like that. And we put it down to that. So it's actually being able to just have a listening ear is what I would suggest, actually, is the most important thing.
Absolutely. I think that was a great answer. I'm just conscious of time, and there is one more question that I think we should just touch upon that's in the chat. And the question is, how can we, and it's broadly around different journeys to menopause, whether that be early onset, forced, medical, etc. How can we better support those whose menopause journey doesn't follow the expected path? Early recognition, understanding and signposting, such as standard tests, don't always detect this, such as premature ovarian failure can be in your 20s and showing up by AMH tests due to fertility treatments. Nadira, do you want to take that?
Yeah, sure. So as I said, everybody's individualized. So POI, so primary ovarian insufficiency, is very different to somebody who's going through a natural menopause as well. If you have, so if I could sort of talk about the menopause first, so the periods are the last thing to change. If someone's going through a natural menopause, the period symptoms are actually the last thing to go. So I often have women say to me, oh, my periods are absolutely fine, they're still regular, I don't think I'm perimenopausal. I say to women, if you're over the age of 45, classically, then you are in that phase before you're on a period. If you're having primary ovarian insufficiency, your periods may be irregular. So you might need to go to the GP to have investigations done. If you have symptoms that you think are concerning, please go to your GP. I would consult with anybody over and over again if they've got concerns. It's not a problem. So please just approach your GP and just express your concerns. Say, I think I have this, and then you both know exactly where you're coming from as well.
Perfect. Going in forearmed with that information and saying what you think you've got is really powerful, isn't it?
Yep.
In the interest of time, I am just going to ask my final question of our three panelists. And what is the one key take home you would offer to our audience today on the topic of menopause? And I am going to go to Lou first. What do you want them to remember from today?
In a nutshell, keep your chin up. It's not all doom and gloom. There is light at the end of the tunnel. If you're passionate, you can change anything. I truly believe that. And back to Nadira's point, listen, talk, educate, listen, talk. That's it for me.
They're the love. I would agree with you. Nothing. If you're passionate about something, there is nothing you can't
take on the world.
Thank you, Lou. Mel.
Yeah, I think I said before, my mantra is education is key and that knowledge is power, definitely. But yeah, just echoing what Lou said, it's not all doom and gloom. You know, in some cultures, women call it their second spring. And it's about, you know, so you get that emotional clarity and you don't feel like you've got to explain yourself to anyone. You're more in tune with your own body and you know what your boundaries are. And in line with, well, menopause day and lifestyle medicine, it's about, I think people start to take more of a holistic approach with their bodies and start to look after themselves a bit better. And, you know, last year I took up yoga and meditation, and it works for me and I love it. So it's whatever works for you, just do it and just, you know, do what works.
Perfect. Good answer. And Nadira, what would be your takeaway for everyone?
Set yourself a challenge every day, you know, just a small challenge. If it means that you've got anxiety going out the door, set your challenge by putting your coat on and approaching the front door. The next time, go to the end of the drive, come back, set yourself, go to the first lamppost, come back. So set yourself a challenge every single day. And if you don't fulfill it, it's not the end of the world. It's absolutely fine. Set a new challenge for the day after, because that's what the menopause is. It's a new journey. It's a new journey into living our best life. And we'll get there. We'll definitely get there. So it is, yeah, definitely embrace it. Life is short.
It absolutely is. I could not agree more. I agree with all of those, and I'm only going to include mine because I often get asked, what do I hope for the future? And I hope that our well, I've got a daughter who's 26. I hope that my daughter isn't going on sessions like this in the future, because we don't need them, because it is simply something that we talk about on a regular basis. There's a common understanding, there's a common education, and it's just part and parcel of your career throughout life, etc. So that is my hope for the future. But in the meantime, I think people like our panel today are doing an incredible job of getting that messaging out there, both from a lifestyle, a work and a medical perspective. So it's been an absolute honour to have you on today. It's been so interesting to hear about the work that you're doing. Thank you for being a great audience. We've had some brilliant questions, which we appreciate, because the interaction is really, really important. So in the interest of good timekeeping, I will thank you all for attending today. And please reach out if you would like more information from Wellbeing of Women. Thank you.
Thank you.